All right, good morning, Chair Postman, members, Garrett Vollendroff, staff and guests. The lobbies are open and the recording has begun.
Great, thanks, Justin. Good morning, everybody. We'll convene the board caucus meeting for Tuesday, April 25th, 2023. We've got a full agenda today, so we'll jump right in with Mark Webster with a post-session legislative update. Hi, Mark.
Good morning, Chair Postman and members Garrett and Vollendroff. As you said, the 2023 legislative session is officially over, and I am very excited to do my first interim presentation to you. Signing out was Sunday, and the chambers passed the final budget, and more on that in just a little bit. But they did leave without a permanent solution to the Blake case, and thus drug possession and use becomes legal on July 1. So we are certain to have a short, hopefully, special session at some point soon. Our two agency request bills have been delivered to the governor, so I hope we hear very soon about when those will be signed. Again, pre-pandemic, there would be open signing ceremonies, and for some bills, they'd have dozens and dozens of people. And then during the pandemic, of course, no one was allowed in, and they'd just be on TVW. This year, they're kind of splitting the difference. They will be in person with people in the room, and I'll be up on the Hill for one of those today. But the number of people are strictly limited, and so we're just going to have to see how this goes. I think bill sponsors can name 5 people, and agencies can name 3. So we'll, you know, as we learn more and as we get a schedule for those bills, we can talk more about that. The conference budgets passed at the weekend included not just many of the bills that we've spent session discussing, but also provisos, the funding targeted at a specific project or need. The DDE pesticide issue led to many discussions with members that we all had, and they had to respond. They had to come up with some kind of a response in a few days before the session ended. So they did this with a $5 million soil remediation project helmed by the Department of Ecology that was funded in the 23-25 capital budget, and it directs them to work with the LCB. And then a reimbursement project for bringing in soil that would be run by the Department of Agriculture right now. So that's in the 2023 supplemental operating budget to help those farmers if they want to bring in new topsoil, right now before July 1. We're going to learn a lot, I think, over the next few years about what can be done to remediate these soils and how best to grow in sites on or near land that used to be orchards. Taking a step back, I really just want to thank you for all of your help this session. I think our agency request bills passed, obviously after some major changes by our friends in the legislature. And I'd love to talk with you all, members of the board, during the interim about what worked well, what worked less well, and how best to get your input into the policies we can support. We've started to have those discussions in this forum and in others from time to time. But I think we should sit down and have maybe a longer conversation about that before we put together our budget request and legislative agenda for the next year. And think about ways, how do we get the input from that new research department that we're going to be embarking on? How does that flow in and impact what we want to do both in the budget and legislatively? We talked about it at EMT, but the director's office is developing an implementation dashboard to look at all of the work that the legislature has tasked us with. So the bills, the provisos, reports, task forces, and work groups, and how we're doing at getting that work done. Jessica Dang in the office is helming that, and I'll be working with her, and I really can't wait to show you what we come up with.
Just a quick question on that. Have we ever done an implementation dashboard following session, or is this brand new?
I'm the new guy, so I might look to you.
There hasn't been anything that formal, certainly in my time, or I haven't heard of it. So, and I think it's a great idea.
I do too. I just wanted to endorse that, and especially if it's brand new, to give kudos to whoever is working on that, and look forward to seeing what that looks like.
That's terrific. You never know what's hidden away in the budget.
Yeah, there's just so many things, work groups in some of these bills, work groups that we're on that are, in somebody else's bill or somebody else's budget, but we've got to keep our eye on it.
Just like the two things you just mentioned about DDE, how do we play into those two pieces, and who does it? And, I look forward to actually seeing everything a dashboard. That's great, Mark. Yeah, I mean, I think we should talk throughout the interim, obviously, and as we start to develop the next agenda too. But I hope you know what a great job we all think you did, and really made a difference up there. And the fact that our agency requests legislation, it changed, of course, it always changes. But I felt like those bills were treated with respect, if you will, like there was some standing that we had there, and you were a big part of that. And obviously, Ollie on the social equity piece, I think you guys presented that in just such an incredible way that went better than I thought it could, maybe would, like it was better than in the past. And it's just I thought that bill in particular just did such a great job of staff and board member working together. And others, the governor's office too, and I really like that kind of collaboration and things. And the THC bill is almost like this afterthought, whereas that's such a complicated bill, was so hard last year, but we did a lot of that work last year too, and I think that helped set the stage, and we just all understood that issue better this year than we did last year, and to be able to see them. Both those bills pass with industry not laying down in the middle of the railroad track, at least to stop it, maybe not loving them, is really important, I think.
Yeah, a lot of work in rulemaking to come, but that's a good problem to have.
Yeah, that's true. Yeah, we asked for that, right? We can't complain about rulemaking for our own bills, but it's all the other ones that we're going to have to see, and that dashboard will help us figure out how to triage all that work that's coming.
Right. Yeah. Who's on first for a lot of these things? Like who's the point person for some of these things? Who do we name to the myriad task forces and work groups?
And we got the alcohol delivery recommendations that have to be delivered by the fall, and there's a lot, but
there's a lot.
Okay. Any other questions or comments on Ledge? Okay, thanks, Mark. Take it easy if you can. At least till the special session.
Right.
Yeah. All right.
Don't want to think about that right now.
No. Good idea. Okay, next up, Mary Sagawa, our public health education liaison, is going to update us on alcohol impact areas. I think we have two to talk about today, and there she is and her slide. Good morning.
Good morning. Good morning, Chair Postman and board members Vollendorf and Garrett. Thank you for the opportunity to be with you today to talk about the alcohol impact areas reports. I know that for some of you, well, for two of you, it's been a long time since you've heard any reports from the alcohol impact areas. And for board member Vollendorf, this is the first round. So I want to start, we actually have 3 reports today, 2 of our active areas, and then one that is no longer in effect. And so what I'll do is go through these rather quickly, but I want you to know that the reports are available for you to look at the entire report. I pulled out what I thought were the key areas. So as a little bit of background, alcohol impact areas came into being back in the early 2000s. It had to do with Seattle calling a meeting and including the Liquor Control Board at the time to talk about the issues in their downtown area with chronic public inebriation and look for solutions or things that can at least contribute to a solution for that. So with that, the alcohol impact areas were established through WAC, and the overall goal was improving public safety and public health in those areas and improving the community well-being. These were looked at as one possible tool, and you might say in the whole comprehensive toolbox of what cities and communities can do. The alcohol impact areas needed to be focused, excuse me, in one specific area of the city. It couldn't be the whole city. And so that was an important piece. We have had some jurisdictions wanting to have their whole community be designated as an alcohol impact area. And that is not possible based on our WAC. So the first one, even though Seattle came forward with this, the first actual impact area was established in Tacoma in 2001. So the requirements were that a city or a jurisdiction needed to do a voluntary impact area, and it had to be done by ordinance. So, and this time period had to be at least 6 months where they took action that would sorry, my computer wanted to restart. Had to do a snooze on that. Um, they had to make this, get voluntary cooperation from retailers in that area from the licensees, worked with the community trying to mitigate the problems without the actual impact area being designated through by the board. If that didn't work, and it often did not, they could then petition the board. They would have to demonstrate the need. They would bring in statistics from police, from fire, look at detox reports, look at what the community was doing litter patrols, determining which products were causing the problems. And then at that time, they could request special conditions. And for most of them, that meant a restriction on certain containers of alcohol, basically the high volume, high ABV, um, single serve containers. A few years ago, we changed the reporting requirements that they would report after the first year and then every 5 years. So the current locations are listed here. And today, today we'll talk about Seattle, Everett, and then Spokane. So Everett was one of the more recent jurisdictions that set up an alcohol impact area. You can see that what they did was they built it around a particular major artery within Everett and the problems along that artery. Over the last 5 years, these are their statistics: a 27% decrease in alcohol-related incidents within the boundaries and 15% increase outside the designated area. So you can see there has been an impact in that area. This gives you the year 1 through 5 statistics. And again, you see that the amount that were good, the calls have gone down outside the AIA, and then overall the city of Everett. So one of the things too that I want to say is that we know that over the past 5 years, there's been a lot of changes in the jurisdictions based on COVID impact, based on the increase in unhoused persons, the services available in these communities. So as you look at some of these statistics, I think we also need to keep in mind that our environment overall has changed. So I'm going to move on to Seattle. Seattle started with a Pioneer Square alcohol impact area, and then they expanded it to the central core, and then eventually the establishment of the North alcohol impact area, which encompasses the U District area. Currently, they have 46 brands of products that are on their list that are banned and not allowed to be sold in those areas. And I will add that at this time, with these reports from Seattle and Everett, neither of them are currently requesting additional restrictions, which they can do at the time of their report. The data that's been reported, if you were to compare to previous reports, there has been a difference in how they've collected the data, and they wanted to point that out in their report. It used to be, it included all crimes that they believed were related to liquor, and now it only is general offense reports that explicitly say that they're tied to alcohol, liquor, or intoxication. This is the data from 2017 to 2021. Liquor law violations had their biggest reduction of 67% from 2019 to 20 and 73% from 20 to 21. Pretty significant. We do need to keep in mind this is during COVID, so there probably was an impact there. Nevertheless, these numbers look really good. DUI totals have steadily decreased, but then increased 30% from 20 to 21. This really is in line with what we're seeing across the state on DUIs, that those numbers have gone up significantly across the state, especially alcohol-related deaths, collisions that resulted in deaths. Their intoxication and liquor violations, these are their community generated and officer generated dispatch calls. And you can see the decline that from this starts January 2017. I know these numbers are pretty small, but January 2017 to December 2021. And there were some spikes, but they've come back down. And then this separates those out into the community generated and the officer generated and the types of calls. And again, if you look at the intoxication and liquor violations going from 9,469 in 2017 to 5,136 in 21. And then officer generated, again, you see a big decrease from 1,412 to 462. Now, I will say that, this also raises the question, we don't have a comparison here to what fentanyl calls. And we know that in the Seattle and King County, fentanyl deaths have increased significantly. And so whether there's more of an emphasis there, I don't know, but these are the calls that come in related to intoxicated persons. The crime data, this is the North Alcohol Impact Area. And again, there's a decrease in number of reports here. And again, the DUI totals increased 129% from 2020 to 2021. So again, we have the issues with DUI. Intoxication and liquor violations in the North AIA, this is the chart. And again, there are times of peaks in different months. But again, by the time we hit December, and it used to be that there would be more calls around holidays. This is kind of an interesting one for me, that the drop in December. And again, 2021 was the lowest recorded total for both community and officer generated calls. And then again, they have the breakdown here of divided by community generated and officer generated. And again, you're seeing that decrease overall. Seattle Fire Department related EMS calls. The 2022 data here again is only through August, and we know that not all of the reports have location data associated with them, but this is what we do have. So you're looking at EMS calls in the AIAs that you can see where they've decreased significantly. And the percent, although the percent of overall calls stayed about the same. So looking specifically at the North AIA, 3% across the board, but the numbers are much lower. Seattle also provided testimonials, letters from all of these organizations and declarations from the 2 Seattle PD officers listed at the bottom, all in support of the alcohol impact area. So with that, I'll move on then to Spokane. But before I do, since these are the two alcohol impact areas that are in effect, do you have any questions regarding those reports?
I have comments, Mary, but I think I'm going to wait for you to conclude and then I'll make my comment.
Okay, thank you.
Mary, I have one question. You said that there hadn't been, I think we were still on Everett at the time, but anyhow, there hadn't been requests to add any additional products. Which is surprising only because I would think there'd be new products coming on the market all the time. Is there a mechanism is anybody looking to see if there's something new that's out there that's just as bad or worse than what they've banned, but is on the shelf?
Yeah, we've had a couple of interesting things come up just in the last couple of months. Um, the Tacoma alcohol impact area has specified, when they did their list, they specified products as specifically as wine-based and as malt-based. And now there's a product that traditionally has been wine-based, and appears they're now making a version of it malt base, but it still has the same ABV. It's still kind of the same product. We're trying to find out for sure if it is indeed malt based. And then I think the question there will be whether Tacoma wants to look at that. The other jurisdictions didn't divide their lists into those categories. They just listed all the products. And so that was kind of an interesting one. Um, City of Olympia, their report is going to be due next year at this time, and they are looking at what they might do in addition to what they have right now because of some issues they're having in the downtown area. And I had a meeting with a rep from the City of Olympia a couple of weeks ago, and we talked about what they would need to do to add products to that list. One of the difficulties is that it takes a fair amount of work to add products to the list. They need to do litter surveys. They need to really um, gather a fair amount of data to do this. We don't have a formula that we can use to say, okay, any products this size, this ABV, um, single serve, whatever. We we don't currently have that kind of a formula. So they have to prove that this product is a problem. And then the question is, how much is too much?
Right.
You know,
Right. Yep.
it's how many empty cans do we need to show you that are on the street? And so it's not an easy process, but I think my guess would be if we reached out, they would say, yeah, there are products on the shelves now that are pretty much identical to things on their banned product list.
Okay, thank you.
Okay. So as I move into the Spokane report, before I jump into that specifically, um, back in October of 2022, Spokane was doing some work on their ordinances, and they were repealing and reinstating some ordinances, kind of doing a cleanup is my understanding. And in the process of doing that, it was inadvertently missed that they had not reinstated the ordinance that specified the alcohol impact area. There were discussions within some council members. There was a committee meeting, and it was decided they didn't want to do that without gathering more data and doing more of a look at the alcohol impact areas. For us, with our wax, they have to have the ordinance to have the alcohol impact area in effect. And when this hadn't been reinstated within a timely fashion, we had to say, you don't have an ordinance, you don't have an alcohol impact area. But we did ask for a final report, and I want to extend appreciation to the city of Spokane for being willing to do a final report for us. And so this is the information. They also had some caveats for their report. the 2000, oh, I'm sorry, this is a typo. It should say data for 2022 includes all 2022 data, not 2002. I'll fix that before we finalize this. So it will include the whole year. And they also had some things that affected how they compiled their data. There were decreases and increases in patrol staffing, economic and social factors, which we talked about, the pandemic, and then the restructuring, and they implemented this new national incident-based reporting system, which changes somewhat how the data is reported. So just those caveats for their data. They have had two alcohol impact areas, the downtown alcohol impact area, and this report, again, this was implemented in 2010 and repealed in 2022. These were the calls for service from 2018 to 2022. And you can see there was a bump in 2019 and then came down during the pandemic, up a little bit in 2022 with 9,320 calls. This is the list of the different kinds of calls that they were receiving, and it shows, you can see a decrease in almost every type of call. The increases only are showing under trespassing and uninvited or unwanted guest. And so this would be an apartment where maybe they had a gathering and somebody wasn't leaving and they called to get rid of that person, those kinds of situations.
Hey, Mary,
Yes,
what is, I think it's pedestrian violation is my guess, PEDVIO, is that pedestrian violation?
yes,
Okay.
yes. And then I had some questions on these too. So SUSPER, suspicious persons, uh, welfare rechecks,
Okay.
and then persons bothering others on the bottom.
Great.
Okay. So the percent change when you compare as a whole, you can see that in 2019, it went up a little bit for the downtown area, kind of matched citywide, and again, went up for 2022. Again, some notes here on the side. During this time, the AIA became the primary site of numerous service providers for people experiencing homelessness. So it hosts a high number of low barrier housing developments in the area. So again, trying to take the whole environment into consideration as we look at these. You'll see similar for the East Central alcohol impact area. This was implemented in 2012 and then repealed in 2022. And the reason these reports specifically are from 2020 to 2022 was they had a 5-year report prior to this. So these are the calls for service in that central area, East Central AIA. And again, you see the dip in 2021 and then it's coming back up a bit in 2022. And same on comparing calls for service. You see the trespassing has gone up, uninvited guests has gone up, a little higher on persons bothering other persons also. And again, here's your change for the city as a whole. And the AIA going up between 2021 and 2022. But it still generally had a lower rate of increase in calls than the city of Spokane as a whole. So those are the summaries of the reports. And I know Board Member Bollendorf, you had some comments, I believe.
Yeah. David, is it all right if I just jump in here for a sec? So first of all, thank you for that great report, and thank you for sharing. I asked Mary to send me these in advance, and I was impressed, particularly by the quality of the reports from the jurisdictions that reported. So acknowledge that. So although Mary acknowledged that this is my first briefing on alcohol impacts areas, I have been working with alcohol impact areas from a public health perspective for my entire career. And these are but one tool that a community can use when they're dealing with problematic alcohol consumption in a designated area of a community. And it's but one tool of a comprehensive set of approaches that a community can do. And so I just wanted to use that as an opportunity to explain that a little bit more. The other thing that I was thinking about, Mary, as you were talking, the PAIR team is looking right now at the opportunities for where do we currently engage with community. And I don't know if we put alcohol impact areas on that list, because there's a prime example of the LCB partnering with communities to address a community concern. The other thing that I wanted to point out is the type of individual that we're talking about that's impacting a community that might want to have a community implement an alcohol impact area. So when you're talking about substance use disorders, the vast majority of the community does not have a substance use disorder. So this particular set of laws and rules wouldn't apply to them. There's another segment of people who are what we would call substance misusers. So maybe they're misusing substances, but they're not yet have a substance use disorder. This law would also not impact that group of individuals. The group that we're talking about, so substance use disorder is on a continuum to somebody who is early on in their diagnosis to somebody who's at the far end. So think about cancer. When you've got stage 1 cancer, you're on the early stage or the early part of the continuum of cancer. When you've got stage 4 cancer, you are in the deepest, you have very serious, cancer. And so you're at the most chronic stage of cancer. With substance use disorder, you've got early substance use, and then you've got chronic substance. This population that communities are talking about are those individuals who are the most chronic users of substances in their community. And the data clearly shows the impact that they have on communities. So this, again, is just one tool that I think is super important for communities. And then looking at this data and thinking about our new research team, what an incredible opportunity for us to partner with communities and to look at this data and see how we can use this data across the different impact areas to see the true impact. And then Mary, finally, I had a question about, from your perspective, is it time for us to look at these laws? I mean, I don't know if it's, I'm always interested in going, okay, this was implemented at a certain point in period of time. Things have changed. Is it time from your perspective for us to look at these laws and potentially update them?
Well, at the risk of uh, creating more work for the policy team right now, um, yes, I believe it is. I think that we haven't looked at our WACs since, oh gosh, I'm gonna guess maybe 2015, 16, something like that. I'd have to go back and look. And I think that there's, we talk about that, I think, for all of our WACs, that periodic review. And I think this is one area that we can look at, what has worked, what can we fix about it. Chair Postman, when you asked about the products, how hard do we make it for products to be added to this list? Could we look at how we're doing that? I think there are opportunities to improve what we're doing. It's been a while since we've sat down in these communities. I mean, I'm not sure when we last did, to really have that discussion of what's working, what's not. I think the City of Olympia reaching out a year ahead of their report being due to talk about what they might do, what they might add, how they might look at this presents an opportunity here in Olympia. And I think it would be great to do that in the other jurisdictions and say, how's this working? Are there things that could make this better for you? How might we support these efforts in a stronger way?
Thank you.
You're welcome. Thank you for the question.
Rick has his hand up. Rick, go ahead.
Good morning, board, staff. Jim, that was a great segue into a broader discussion about AIAs. It was over 20 years ago that the board by rule created the alcohol impact areas. And we went through, I want to say, maybe a couple of years of discussion. It took a while to get here. If you recall, Representative Helen Summers from Seattle
Yes.
was the sponsor of legislation to create alcohol impact areas, but it failed. And it failed, honestly, and to be frank, because the alcohol industry fought it. What we had realized, and we remember the Hilltop area in Tacoma and Pioneer Square specifically. We know the history of Pioneer Square. And Jim, I think with your background, you know, the CPI, the chronic public inebriant, that was the legislation that Representative Summers sponsored, was to try to deal with the issue they were having where high octane, low cost 40-ounce beverages were being created by the industry to feed that population.
Yeah.
And it was, you know, Synergy was Pioneer Square area, the Hilltop area are just two big examples at that time. Those communities became the first two. And I remember the success a year and two later that came from Seattle and Tacoma, specifically stating, oh my God, for the first time, we can go back to our parks. Those parks were not able for families and their kids to be able to use. And then it spurred, and I think Mary, we have that history for the board and the staff. It spurred them all over the Spokane, Olympia, Everett, all over the state, looking at ways to deal with really what was a very chronic issue and usually a very specific part of that city. And frankly, we are the only state in the country that has done this. Others have tried and not been successful. Other liquor regulators like ourselves have tried, and frankly, the industry has put. They see it as mini prohibition for us to ban products, and we were very clear in the very beginning that it was a shame that any industry would create such a product. And that was quite a debate we had 20 years ago. But I'll stop there and just say I think it's a perfect opportunity to look at, after 20 years of this, to have that unit and our team kind of look at, are there changes that need to be made to the WAC in order to make it easier for ourselves and local communities? But thanks for bringing the issue up. Appreciate it.
Great.
Okay. Yeah, I agree. We should. The to-do list is so long right now. I don't know where it goes, but I think it's a good question. I think the idea that you have to prove that people are throwing these on the street to stop them seems off to me. I think we should find a way to do it based on the properties of what's being sold, and you know, the marketing firms have so many more resources than we do, and so it's not hard to come up with different products and things of that sort. So anyhow, I would endorse that. But okay, thank you, Mary, for that. Appreciate it. Stand by though. We're gonna move on to the next one, which your part, and Justin Nordhorn, our Director of External Relations, is here as well. Good morning. To take us through a review of the medical cannabis industry, and hopefully talk a little bit about what we might be able to do to improve that system. So Justin, I'll turn it over to you.
Great. Good morning, Chair Postman, members of the board. We'll try to be brief. I know we're a little bit behind schedule, but so Mary and I had encountered a very proactive individual out of Department of Health this last year who was doing a capstone project for their master's program. They really wanted to look at some of the medical cannabis issues in the state, and we said, "Oh, that's perfect," because we're wanting to look at those things too. And so we helped, kind of craft and create some of the surveys that she was implementing. She would come up with the information. We would obviously fine tune some terminology, trying to figure out what type of issues that we wanted to get at. Coupled with this particular survey, we also have seen the University of Waterloo reports, and Mary will be covering a little bit of those. So I'm going to take you through the first survey and kind of highlight where I think we may have opportunities for further exploration around the medical program. And then Mary is going to tie in the University of Waterloo work that we've been doing and continuing to do with them. So one of the things that we saw in this particular survey, and we've also heard of surveys that other folks have conducted, but this was a controlled survey for this student that was able to interact with people at different retail locations. So it wasn't as broad based as far as geography as that we would love to see, but with the limited resource of one, she was trying to do this for her master's program. So she was on Western Washington. She engaged with 12 different physical locations. Plus she expanded it to a digital survey to try to get a higher representation of respondents. And so the survey period that she conducted was November of 2022 through the beginning of January 2023, and ended up with a total of 267 participants. So not a really robust survey, but we thought that was a pretty good start for some baseline information that we had. And 73% of those folks that responded said that they were aware of a medical cannabis program in the state. So over 25% of people weren't even aware that we had any type of a medical program. And I would also say that just because they're aware doesn't mean that they're fully knowledgeable. So I think we have some work to be done about educating people on what is a program, what does it look like, but of course we need to do some improvements as well. When we looked at the folks coming through, there were 194 of those 267 that said that they were aware. And so they kind of filtered out some of the questions. If they weren't aware of anything, that's kind of where their participation had stopped. We also had a number of folks, there were 16% of the respondents were held medical authorizations, but only 6 people out of all of those, which was just over 2% of all respondents, were actually registered patients. And so that really shows a gap on, okay, we've got this disconnect for the patients in that particular area. However, 56% of the total respondents are saying that they would qualify for the medical program. And so we have, a number of folks who are qualifying that choose not to engage. And so when we looked at these more specific breakdowns on the engagement, we have, folks who would be qualifying with a medical or with a qualifying medical condition represented about 39% of all respondents. And so we really see a very low level of participation in comparison to the other respondents in this particular area. So drilling down into, why aren't people engaging in this particular area? And the number one response was they didn't see the benefit. The low tax benefit that's in the stores is not significant enough for participation. And talking with patients over the years, they also see some risks involved, and so the risks are not outweighing any benefits of that program. Other people had said the number 2 respondent was too time consuming. You can just go into the store and buy product right now if it's meeting your needs, whereas if you need to go and get a authorization, go to your doctor, go through all of those things, the time consuming aspects are pretty challenging for folks. And that's too expensive, and that comes into that medical cost up front on, corresponding with your physicians and trying to get the medical authorizations, and all that costs folks an expense. So we also looked at type of product. So we've looked at this a number of times in the industry, and it's not that far off from the regular standards that we see. So the product that people prefer to treat their conditions, flower, edibles, and tinctures are the top 3. And so that doesn't really deviate from the norm that we see with flower and edibles being the top 2 in the state. There were some questions around where they want to get their information, and this is where I found some particularly interesting. So, a number of folks were saying that they're not comfortable speaking to their healthcare provider. So the folks who responded, about 2/3 said they're not comfortable talking with their provider. And yet, when you talk about where do you prefer to get your medical cannabis information, the top one was from their medical provider. So you have kind of a disconnect in that particular area. And then the second topmost way of getting information was through the website. And I think that has to do with the confidentiality, being able to access it on your own time, not having to go in and pay a cost. And so with those two pieces, I think that there's some opportunities for improvement in these areas. Where we're looking at the work that we're doing with the Department of Health. So we have monthly check-ins with them. They're going through some rule development right now on medical compliant product that we're going to be providing feedback and continuous interaction. And then we also just got their program coordinator involved in the CANRA Medical Committee, which she had not been engaging with, and so we made sure that we folded that in. So I think we're learning a lot in those areas, so we could identify some of these areas to look at. But the website information was kind of interesting because the Department of Health and Human Services in Utah actually has a lot of information on their website about qualifying conditions and how medical cannabis can be used or to treat some of these qualifying conditions. Now, when you look at like a 7-page publication from them, the first 5 pages are all disclaimers and warnings about how to do this. But I think that that's appropriate for folks to understand this is what the risks are with the product, and so here's how it might benefit, and here's the risks that are associated. So I think some balanced information on the website could be an opportunity for us in a similar manner to look at that. And one of the big things is, can they find medically compliant product? And the overwhelming answer was no. And when we look across the state, we have, I believe, 3 producers out of over 1,000 producers that are producing medically compliant product. So trying to incentivize folks to be able to have the added costs for production is going to be a challenge if they're not seeing the demand in the store. That's also a challenge. And so I think that there's a lot of exploration we're still trying to do in these areas. The pesticide testing this last year that you approved, I think really closes and narrows that gap. And I think that Department of Health is looking at that and saying, okay, so how can we adjust so we can look at maybe even medically compliant product in a different way? One of the things that people have to do right now is to earmark that product at the growing stage to say this is going to be medically compliant versus I've grown all this product. I'm not sure where I'm going to move this and how I want to deal with it. And so when you're getting towards the end stage and creating your final product, if there were opportunities, I think, to designate it at that point, you may have some more flexibility in your business operations to maybe engage in that because you don't have as much of a gap anymore. And so we're working with Department of Health on that particular concept as well. So it will make it easier for the producers to be able to move through the medically compliant designations and those types of things. So the other, the last thing that was called out is, can you afford these products? And it was, pretty close in that, but about half the people, or just over half the people, were saying no, they couldn't afford the products. And I think a number of folks who have qualifying conditions may not necessarily have the same level of employment and those types of things as others. So it can be challenging for the cost as well as the medical costs on interacting with your provider. So I'll turn it over to Mary to kind of talk a little bit about the International Cannabis Policy Study that was conducted and where we're at with that. And then we'll circle back with some questions if we have time. So Mary.
Hey, thank you, Justin. So we did a report on the International Cannabis Policy Study earlier, but what I want to do is zero in on some of the questions that had to do with medical and just to highlight some of those. So as a reminder, the time period for this study was September 14th through November 8th, 2021. So it's a short time period, but an intense outreach that they do. They looked at in Washington, in the US overall, there were over 30,000 respondents. In Washington, there were 1,799, so almost 1,800. In this, when they asked about past 12-month consumers, there were 25% self-identified as a medical user only, so a quarter of them. When asked if they have ever asked a licensed health professional for a recommendation to use medical marijuana, 24% had, and of those who sought approval, 38% were refused. 18% have ever received a recommendation for medical, and 9% had a recommendation in the past 12 months. So again, fairly small numbers. When asked why they were using cannabis, um, in the mental health category, about 39% said for anxiety, about 30% for depression, and 18% for PTSD or traumatic events. Those were the top three. For physical health, the top three were pain, 38%, problems sleeping, about 30%, and headaches or migraines, 28.5%. In looking at these numbers and this information, the Cannabis Policy Study has a lot of data, and when they send us their report, they really only touch on part of the information that's accessible there because there's so much. Their report for 2022 should be coming out by the end of May. So we're going to have brand new data on this shortly. When that comes out, I think there are some wonderful opportunities for further analysis and recommendations. I think that some of the things we should further analyze with their data, for those who identify as using cannabis for medical reasons, again, look at what's the primary product type, what's the primary source, where are they getting that product? What's their perception of access? How easily is it to get the product? How frequently are they using it? What are the THC and CBD concentrations of products usually used? What kind of combination are they looking for? And what's their proximity to the closest store? And then we can take these results and the results of the capstone project and zero in more on the preferred products and those most often used by those who are using for medical purposes. What are the barriers? Lack of information? Is it proximity to medically endorsed locations? Lack of perceived benefit? Kind of combine all of that. And then what kind of structure and or incentives could there be for increasing availability? And I think Justin talked about some of that as he went through the capstone project. So again, I think getting this data in the next month or so will just contribute to our information to further zero in on what we can do to improve that access.
And the one thing I would also offer on the project, so we are a supporter of the contract with the University of Waterloo on and on, from last year. And so Mary did some really great work working with them on modifying and clarifying some of the questions that we would like to ask. Now, they didn't necessarily adopt everything that we were looking for, but based on the previous survey, we were actually able to fine tune some of those questions. So we're really excited about seeing the data that's coming out towards the end of May to see, were some of the questions that we initially had answered. And I would suspect we'll have a similar opportunity coming up in the next year.
Okay. Well, I appreciate you guys talking about this today. Justin, you and I have talked a lot about medical. I really think we need to do more, but I don't know what it is. And some, we don't have time to really get into it all today, but when you talk about some of the findings in the capstone, which is what we've heard from others as well, people don't see the benefit enough. There's some risks to it. It's too time consuming. And so that makes me question, so we have an existing system that I don't think is being fully utilized. And I think there's things we and Department of Health can do to help that. But then you think, okay, even if it was like really fully utilized and we all were doing everything humanly possible, those issues are still going to remain, right? I mean, it's just, some of that is inherent in the program. So then the next question is, okay, does that mean you need a different program? Because I did go back and read the bill that passed, setting up this new, and there was some legislative intent there that's quite clear. So it's not optional for any of us. Like, we need to do this. I don't have an answer. I was just gonna tell you, when I read those results and I see why people aren't more engaged in the existing system, then we're not doing everything. But even if we were, we don't fix that issue of time consuming, certainly not whether they're gonna talk to their medical providers, because that has to be a part of it. There are some risks, people are concerned about putting their names on lists, and I'm not sure they should, but I get that. And so that's not going to go away. I don't know. So I just think we really need to do more. And I hope we can spend some time this year, the second half of this year, trying to figure out what we could do, just by policy, hopefully, without even having to do rulemaking, to see what we could do if we were, hitting on all cylinders here. Everything we can possibly do, we should do, and we should encourage Department of Health to do as well. I just don't know what it is.
Sure. And I know Kathy's going to cover this hopefully next, but I'll steal a little bit of her thunder on some of this. So when we're talking about prioritization of rural projects, particularly because of all the legislation that's passed, we are going to have to recategorize some areas. And one of the things that we talked about is, there's the endorsement project, and there's also advertising, and looking at what's going to create a better value to the patient. And so there's some discussion going on right now on, one may have to slow down, but where can we actually capitalize the most to add value to the patients? And I think that's the important question, not necessarily what a particular topic is, but how do we add that value?
Mm-hmm. Okay. All right. Other questions or comments on the medical system? No. Okay, great. Thank you both. Appreciate that. More
Appreciate
to
the
come on
time.
that. Yeah. I'm just going to put us at ease for 1 second here so I can consult with Dustin about something. Okay. Okay, Kathy, quick question. How long do you think your report's going to take about?
Well, there's a couple ways we can do this, Chair Postman. The first thing is I can just tell you what I'm going to do, present to the board tomorrow, and we can save the rules update for next week's caucus because there is significant change. So I would say probably 5 minutes at the most.
Yeah, but if we wanted to do the full update.
That would be probably closer to 10 minutes, especially if we
Oh,
want
yeah.
to, share some conversation there.
Yeah. I'm fine with that. We can delay the start of our executive session to do that. We could also do the full rules update at the board meeting tomorrow. I wouldn't want you to have to wait till next week. I think it's an important conversation. I don't know, since the board have Kathy do what we have coming up tomorrow, which I think we know it is, it'll be brief. Would you rather do we're going to talk about what everything they've got in that long list of things and some triage going on. Should we save that for tomorrow? Thoughts?
In the long list of things in triage, is that like an urgency or just updating us to where it could be next board caucus?
It really is just updating Board Member
Right.
Garrett.
Okay.
And just to make sure the board's aware that there are some projects, as Justin noted, that will be paused because we had to reprioritize a lot of work and consolidate where we could. So happy to have that conversation next week.
Okay.
Yeah.
Thank you.
Yes.
All right. Okay. I guess that's true to us. So let's cover the rule
All
petition that we have to act on tomorrow. Sorry for that, Kathy. We just overloaded the agenda here.
No problem at all. And in fact, I really don't have much of an update to provide at all because we discussed this last week.
Right.
And I think there is just one option moving forward with this, and this is the petition to ask us to change a Washington state statute by the rulemaking process. And I don't recall that we had a lot of conversation on it last week because I don't know that we can change statute through the rulemaking process. In fact, I'm 100% sure we can't. So I don't know that there's much discussion for us to have further than that, but I will be presenting, the full analysis and options tomorrow.
Yeah.
Okay.
My only thought, but like I said, there are times where I wish we could,
Yes.
and there's a bunch of
sure.
people that are glad we don't. So, so
But if I may add, we're so fortunate to have such a effective legislative director who does all, does all that for us and through the correct processes. So
that's true.
thank you, Mark,
Yep.
for that.
Sort it out between the two of you, we get it done. So, okay.
Yes.
Thank you for that.
Sure.
We'll have that for action tomorrow at the board meeting, and we'll reschedule the detailed discussion about the update.
Sounds great. Thank you
Okay,
very
Thank
much.
you, Kathy.
Thank you,
Appreciate
Kathy.
that. Okay, so now we're just a short few minutes running late, but the board is going to go into executive session under RCW 4230.110 sub G. The board will go into executive session to evaluate the qualifications of an applicant for public employment or to review the performance of a public employee. We're going to give ourselves up to an hour for this meeting. When we come back at the end of that, the board will not be taking any action. If it goes longer, I'll come back and announce that we're going to extend the executive session. If it ends sooner, as soon as it is over, I will come back and we'll adjourn the rest of the meeting. So with that, I'm just going to ask everybody to, we'll just stand at ease for a minute till we sort the meeting out, and we'll go into executive session. Thanks.
Yeah, there he is.
Okay, right. We have concluded the executive session. The board met an executive session to evaluate the qualifications of an applicant for public employment or to review the performance of a public employee. And with that, we're done with the agenda for today's meeting, and we'll adjourn the caucus meeting for Tuesday, April 25th, 2023. Thanks, everybody.